that renal pelvis here, that little V shape coming through that we can see there and measure it, making sure that's not dilated. If we had some type of ureteral stone or an obstruction, then you might actually be able to trace out a dilated ureter coming off of here. A normal ureter, though, we're probably not going to image very well unless you had a really nice probe that you're working with. So I won't be looking for that today. All right. The other kidney is going to look very similar. This is the left kidney. If I want to continue my urinary system, I come back down to the bladder. Here's bladder. To the left is going to be more towards the apex of the bladder. Towards the right, here's going to be trigone, and here's going to be the urethra, actually coming through right here and going further down. I can get to his prostate as well, just this little thickened area. He's a neutered male while he was younger, so his prostate is not very big. You can see it down there if you go all the way down past the trigone. All right, so here's bladder. Bladder wall thickness should be less than 2 millimeters, making sure that's not thick, making sure you get a good image. Let me decrease my depth a little bit so we can see this better. There we go. So get a good image here, making sure you're seeing, this is kind of the wall thickness. We've got kind of a hyperechoic, hypoechoic, hyperechoic. Those three little white, black, white lines is going to be the wall thickness. Again, it's about 2 millimeters, should be normal. If the bladder is totally empty, sometimes the wall looks a little bit subjectively thickened. So we have to take that into consideration if you're saying the wall is thickened. If we're looking for TCCs, common place is going to be over here within the trigone. If we start seeing these little like polyp kind of undulating masses coming off the wall, and maybe it's a chronic UTI case that you're seeing, or maybe has a UTI right now, there's a condition called polyploid cystitis. Poly meaning multiple of these little polyp-looking structures coming into the lumen of the bladder. That's typically along the apex of the bladder wall and not towards the trigone. So if I'm seeing them up here towards the apex and he has a UTI, likely those polyps are just going to be polyploid cystitis, and we treat them with antibiotics and get rid of the UTI, and they'll do better. If I see those weird polyploid and thickened areas along the trigone, now I'm definitely going to do some additional testing to figure out if this guy has a TCC or not. Let's see if I can see them nicely on this guy. Typically, we'll get a little area of thickening that you can see the ureteral vesicular junction, so where the ureters dump in to the bladder is typically a little thickened area. Let's see on the near wall. Sorry, just give me a second, see if I can find it. Some guys image better than others looking for it. So you'll see a little circular hypoechoic area just as it enters into the area of the trigone. I'm not imaging it very well here. I'd probably do better with my linear probe with a little higher frequency to see that a little bit better. If I did have that probe, I was using it. Sometimes you can even use your color Doppler and actually see flow. It almost looks like Ghostbusters kind of putting their streams out there, and you can actually see the urine flowing in there, especially if you wanted to do like a Lasix trial and see if you have good flow going into the bladder. If you're ever looking for ectopic ureters, that can help prove me that, hey, I actually got the ureter emptying into the bladder if I can see that good flow coming through. All right, so that's a good shot of everything there. Is there anything else I wanted to mention? Just taking a look at my notes. Uterovesicular junction, less than 2 millimeters for the thickness. Blood clots versus sometimes they might have UTIs and have blood clots in here. So it might be really hard to distinguish a mass versus a blood clot. Sometimes what I like to do is put your color Doppler on there again. Blood clots should not have blood flow going through them, and a lot of times if it is like a TCC, leiomyoma, leiomyosarcoma, lymphoma, a lot of those will have blood flow still going through them, so that can help differentiate between the two. If I do have any type of disease, a lot of times I like to come up to this region here. So here's the descending aorta right before you get to your external iliacs branching off. It's a good area to look for the medial iliac lymph nodes. So if there is some prostatic disease, bladder disease, I want to see what's going on here. Also, a great area right up here. When you got those ATE cats, the arterial thromboembolism cats, I'll image up here, get my color Doppler on, making sure I've got good flow pulsating through and everything's open. Sometimes you'll actually see the thrombus in this area with these ATE cats. Most of the time it is pretty proximal on this little trifurcation area. So this is all aorta, and you can see me kind of squishing down. Right below it is the caudal vena cava too. Take color off. So there you go. There's the caudal vena cava, aorta. I can tell the difference because I can squish down and make the caudal vena cava disappear. The aorta, being a more muscular wall, does not disappear as I squish it. All right, so if I was coming up here, I can look for lymph nodes, making sure nothing looks big. Lymph nodes are a little bit more difficult to find, especially when they're normal in size. So it's not something we're really going to focus on an introductory class. But if that was big, a lot of times they'll really pop out at you and be hypoechoic. So you don't have to worry about that. I can follow the aorta all the way up to my left kidney if I wanted to. There you go. And you can see that vessel coming off. It kind of looks like a shepherd's hook coming off of here. I can be my renal artery going in there. Then I'm going to have the cranial mesenteric and the celiac. If you pay attention, want to play around later, there's an adrenal gland coming in right here. Caudal pole, cranial pole. A lot of times I'll measure the caudal pole of that peanut-looking structure right there. But to find the adrenal gland, a lot of times what I do is I take that aorta, find that shepherd's hook or the renal artery, and then I'm going to look for these little snake eye vessels also, kind of up here, being the cranial mesenteric right there. These two, you see those little snake eyes looking at you? Put my focal point down there. These guys. So that's going to be a transverse view of the cranial mesenteric and the celiac arteries. So if I found that shepherd's hook, those two guys, it should be right around that area. And that's what I start seeing right here, coming in for the adrenal gland. A lot of times you can actually make out the cortex and the medulla of the adrenal gland, especially if I increase my frequency a little bit more. This looks like a normal small-sized guy right there. There's the caudal pole. If I wanted to get a good measurement of that caudal pole, right about there, and get my caliper on there, I would just take the width from here to here. Has a width 3.8 millimeters. You got a small little caudal pole. Width of his one. Perfect. So there's an adrenal gland. I didn't mean to go over that today, but it's good if I was up in that area and I was looking at the aorta. That's kind of some of the landmarks we'll use to find that. Anything else? Cats get more ureteral lifts and stuff too, so I'd really like to image that if I was worried about an obstruction somewhere, and really imaging the adrenal gland nicely now. Cute little guy. Right in there. So I can really image that. And normally it goes pretty far dorsally back here when you're tracking it down. You can imagine when you see those ureteral lifts on radiographs, they look kind of dorsal on that lateral radiograph when you're seeing it. All right. So again, just starting getting comfortable with what the normal kidney looks like. And then normally the abnormals will pop out a little bit better. So here's a sagittal view looking at that renal pelvis area right before it's going into the ureters. So if I wanted to measure the diameter there, I could also. Shoot. Oh, it's making me do. It's asking me to say what I'm actually measuring. Distance, yes. So pretty small, 1.4 millimeters would be my renal pelvis right there. But you can see it kind of coming here right through the renal sinus. Renal pelvis goes into that sinus right there and then down the ureters. If it was dilated, then sometimes you can actually follow that ureter all the way out. You can look for areas of dilation and stuff too, proximal towards where the actual stone is. There's the adrenal gland again, coming into view right here. All right, and that's our urinary stuff, guys.